Welcome to the Brave Talk Show. Brave women, bold topics, nothing is off the table. Wait till you hear what we have to talk about today. In today's episode, we are talking about how to be healthy, happy, and horny with hormone therapy.
I have some questions for you. Hey, brave girl, how you do the things that you do?
All right, so let's jump into the heart of our episode today, and that is we have a wonderful guest, Kelly Lewis. She's the co-owner and acting medical director of Avanti Medical Center here in Lehi, Utah. The Avanti team offers state-of-the-art health and wellness services. She graduated from Westminster College, where she earned the qualifications to serve as a nurse practitioner. She is certified with the ANCC and has postgraduate certifications in aesthetics and bioidentical hormone therapy. Kelly is here to help us understand why it's best to not ignore our hormones and what we can do to feel our best. Kelly, thank you so much for being here. I'm so excited to have you, mostly because I'm being selfish. I am going to see Kelly. Kelly's going to do my blood work on this Wednesday, and we're going to get all of my problems solved, right? Okay, so here's...
That is an honest shout out. I'll live up to that.
Yeah. I'm so excited, like really. We'll dive into some more. I'll be pretty vulnerable and share some of the things that I'm going through. But we had a friend introduce us who she was going through some things, and you really have like revolutionized her life and turned it around, and she introduced us. So now I set up an appointment, and then I wanted you to come here to tell all of us, because women have been ignoring hormones for a long time. Like, I know I personally have gone in, so I trained for a triathlon a couple years ago, and I was just feeling so tired and just brain fog and all of these different things. And I'm like, I need to get my blood work done. So I went into the family practitioner, had my blood work done. They're like, you're fine. You're just a mom. And I'm like, well, I am training for a triathlon. They're like, why are you even here? Like, why did we even waste our time with the blood set? Like, you're training for a triathlon. You're a mom. Of course you're tired. Of course you have the brain fog. Of course all of these symptoms. And I'm like, oh, okay, that sucks.
I guess I have to just stay in this misery.
I know. I'm like, am I destined to be tired and lethargic as a mom? Like, I don't want to be that mom for my kids.
Yeah, we're just so overlooked. So it has really been important to me to focus on women's sexual health and overall health and wellness. And through regenerative medicine, we're jumping out in the front. Yeah. And we're trying to get things fixed, because hormone imbalances, generally, we act like it's a location. Menopause, PMS, infertility. Yes. Well, you're still all those things throughout your lifespan, but nobody addresses it for the continuum of your life. So,
well, and I've always associated it only with, like, as it relates to sex. Like, it's there to help me make breast milk and make babies and have a period. But it's so much more than that.
Right. Well, we think testosterone's just for men. So I run women 30% of a male level. And that's what works, because we have all the same needs. We need sex drive. We need muscle mass. We need reductions in inflammation and clear thinking and energy, motivation, stamina, muscle recovery, all those things that you were feeling frustrated when your primary care told you were just fine.
Oh, man, yeah.
And I can attest, so I was just telling off screen, I'm like, what? You're right by my house. I need to come to your clinic. I am actually currently on testosterone, and I've never felt better.
Really?
Yeah.
Yeah, I've always just thought of testosterone as a male. Like,
and I don't want to take it. Am I going to grow a penis? Am I going to have a dark voice? Am I going to have a mustache? Am I going to have acne? And I'm here to tell you, I don't have any of that.
Wow.
I'm so glad to hear that.
Yeah. So what is it that, like, somebody come into your office, what are the things that you're seeing a lot of?
What's the symptoms of this?
The women come in and there's checkbox that they fill out of how they're not feeling well. And so generally they have no energy. So it's the fatigue, no motivation, they have no stamina, they're going to the gym, seeing zero results physically, but they're putting in the work, they're eating clean. Their sex drive's in the toilet. They'd rather just be your cuddle buddy, you know, and I hear that so much. And it's important that women understand that we need testosterone too, or you're essentially hormonally castrated, if you will.
Yeah.
You
So
know,
let's
you
say
really
this.
are.
Interesting.
I come to your office.
All right, let's give all the symptoms.
And I say, sex drive, non-existent. I'll have it, and when I have it, it's great, but I have no motivation at all to do it. And I don't get initiate it, and I don't get like where I'm like, you know, horny.
I can turn that around in a month or quicker for you.
My husband would love
What
it.
is that
I know.
associated with? Like what hormone is usually off when your sex drive is just down the
Low testosterone. So I like to run women 200s and 300s on a total testosterone level. Most come through my door with a testosterone level of less than 50.
So what's
Yeah.
a
Mine's probably like
normal-
10 right now.
What's a healthy testosterone level for a woman?
250 to 350 is a really nice range.
And most of us are so depleted.
So depleted. So that'd be
So
about
what
30%
causes
of a
it to
nice male
deplete?
level.
Stress?
Many things. Stress, hormone imbalances that we just genetically have inherited. I think our food. I think our food is a problem. I think the air we breathe. I think it's all a problem.
Yeah.
Because we've seen levels decline even in men almost by 50% in the last 10 years.
Really?
So
Really?
something's going wrong out there. But I've never had a woman that came through the door we couldn't change her life in some significant way.
Wow.
So
I love that because it's not just where like you want to be fine. We want to thrive,
wanna be
right?
optimal.
Yeah, we want.
best version of you. I mean,
like that.
women deserve to always feel great. I don't care if you're a mom. I'm a mom. I'm a grandma. But you can still feel great. You just got to have the right balance. And we need that testosterone. And unfortunately, it's just overlooked for women so much.
Let's talk about testosterone modalities, because I talked to you offset too. I'm currently taking injections, but you were telling me that's maybe not the best way I should be doing it. I
Yeah.
want to hear the options and what you
So usually
recommend.
injections are synthetic. Most of what I do is plant-based. So all the things you've heard about, we're going to cause cancer, we're going to get strokes and clots, just throw that out the door because that's synthetic big pharma medicine.
So that's what I'm taking?
Well, if you're on a synthetic shot, which you probably are.
Check.
Yeah, it's not that I won't do that if somebody wants that, but I try and stay as plant-based as we can. And we specialize in pellet therapy.
Okay, so
So
what's
if they're small, but look about the size of a little Tic Tac or smaller, and we do a little implant in your hip, and you form a blood supply around it and pull from it when you need it.
Wow. So
Does it hurt?
No, doesn't hurt at all.
So that's one of my
Can
questions.
I feel it? Is there a bump?
I put it down deep enough that, I mean, if you were digging around, you might feel something, but it's usually in the tissue
How long do
pretty
you
nice.
keep it there for?
It just dissolves over time. So the longer you have it, the smaller it gets, and then we just do another implant on the opposite hip the next time. So about every 3 or 4 months, I'd be seeing you.
And what does that
Okay.
help? So, I mean,
That's
So it helps the sex.
testosterone.
So it helps
So
the
instead
sex
of taking
drive.
a shot, she's putting a
A
pellet.
pellet, little
Pellet.
pellets. Yeah, and pellet therapy came around in 1940. They got ran out by big pharma. I've been at this decades, but everything you hear from the doctor, you can't do it, it's not safe, you'll get cancer, it's because they're only talking about what they have access to and do. And they'll still tell you this does that, but they don't understand it. They just don't know what they don't know. Because bioidentical hormone therapy means exactly that's biologically identical to what we produce. So your body goes, oh, I like this. I know what this is. Versus going, what is that? That's an imposter. I think I'll form a cancer or a clot because I don't know what that is.
And you said about in a month you could turn somebody around.
They kick in
you
a
could help
week and peak in 30 days. For me, it was day 5. I just sat up at 7 a.m. on a Saturday and went, what am I going to do today? And that was really unusual.
Yeah.
So, and I hear women all day long, their libido's just trashed. And it's hurting their marriage. So now it's cute. I've got these patients come in and they were literally had almost nothing going on with their intimacy. Now they're doing things out in public.
Oh no!
You're like, okay, you need to calm down.
public.
I wouldn't say calm down, I said just don't get caught.
right.
That's what, like, I was just telling them. So that's why I wanted to coach, because I'm known on the
She's
talk show.
notorious on the show for
I'm-
having a lot of sex.
7 times a week.
Oh, I thought you were gonna say date. I'm like, that has never happened. No, but I'm the horny one, right? Like, I love sex. But ever since I had Vera, I don't like nothing. And I told my husband, I'm like, I think my body's broken. Like, I've had 5 kids, 4 other babies. My libido never changed. It wasn't until this 5th baby where all of a sudden I'm like,
Yeah.
I'd rather just go to bed.
Yeah.
Like, that's terrible.
Yeah.
But isn't that associated with you breastfeeding? Like for me, when I breastfed my kids, my libido crashed too. And I was told that it's because my progesterone's up in order to make the breast milk, and that's just part of like your body's way of like trying to prevent babies, and then it goes away once you're done breastfeeding. Is this true?
It's never that textbook, to be honest.
I say I breastfed 4
Almost
other babies.
everything I know, I've learned from people I treat. Not once does a textbook walk through my door.
Yeah.
So I've got decades of just listening. And before I can really treat somebody, I get to know them a little bit. And you can't really help somebody if you don't really know them.
Feel that way
Because,
more, yeah.
because my goal is if you want to go as hard and fast as you, and we want to get you fixed quick, we'll go there. You want to approach it cautiously, we'll go there too. I want you to feel like you have a say in what we're doing.
That's great.
Yeah.
So, with having a baby, I had somebody ask this on our Instagram. How soon after is it even worth getting tested? Because you know your hormones are crazy after having a baby, right? Like, is it worth getting tested after a baby, or how long should you wait until?
Usually once the bleeding stops
Really?
postpartum, yeah. Yeah.
So that's one of the things about me that I was like, I should probably get tested because I bled, but then it's been obviously Vera's almost 4 months old, but I've had a couple times where I thought I was on my period, but it wasn't my period, where I'm just like randomly
Spotted.
bleeding, and I'm like,
So we've
that's
got to
not
look at your
normal, right?
progesterone, your estrogen, your testosterone levels, and just balance them. And even take a look at thyroid, because that can be upregulated or downregulated depending on, is it a pituitary issue? Is it just a gland issue of somewhere else in your body? Or I think we've got a lot of chronic inflammation from the way we eat and live.
Yeah. So anytime after bleeding stops, a postpartum woman can come in.
Yeah, and if she's suffering, I'll take anybody, really, if somebody's suffering. I mean, you hear about women that go psychotic after they have babies. It's because their progesterone goes from 200 to 0 so that they can bleed.
Yeah.
And 200 to 0 for some of us women, you lose your ever-loving mind.
Yeah.
People like me, we just coast along. So what you need is, you don't need an antidepressant, you just need some natural plant-based progesterone to ease you down from where you were at.
I personally think if there's ever a time that's crucial to get your hormones checked, it's after having babies. So I actually was talking about hormones not too long ago on my Instagram, and I probably had 500 women comment and say, wait, what? You're on testosterone? I thought that was a man thing. Wait,
Exactly.
You're taking all these things. Wait, you get checked after babies? And I must be rare because I've gotten my hormones tested every time I have a
Really?
kid, every single time.
Yeah.
And everything is something off, and they immediately gave me hormone, because I don't know who told me, but before I had kids, they were just like, go get tested because like you're breastfeeding and you have all these things and like you're gonna be wackadoodle. So almost within like a couple months after having every 4 of my babies, I always get tested.
Yeah.
And I currently am on numerous things like progesterone, testosterone. I have something for my acne, I have something for my thyroid, like all these things, and I'm like, I've never felt better. And I want all my friends to feel the same way.
Yeah.
So we're gonna come to Kelly.
I love that. So I'm mostly word of mouth or Google. We're pretty proud of our all 5-star reviews.
Yeah.
So I see patients from all over the United States.
I love that you said you like get to know your patient. You want to know what they want. What's the solution that they're looking for, and they're not
Isn't
just
that the worst when your doctor tells you you're fine, and then women really do feel like they're crazy.
Yep.
Their husbands are getting really frustrated. The marriages are struggling, right? And it just
Yeah.
doesn't have to be that way. I am telling you what, you get on that testosterone, and your husband might not keep up with you.
Yeah, that's awesome.
Yeah.
So if you're
I know, it
symptomatic,
seems odd.
if you have
like
a low
unbelievable
sex drive and you have low muscle tone and low energy, that's a symptom of having low testosterone.
Low testosterone.
What's
Think
a
about me,
symptom
and
of
then-
having low progesterone or low estrogen?
So
Like, what are
lo-
those like?
Yes, that's a great question. So low progesterone, you might see a lot of breakthrough bleeding, a lot of headaches, difficulty sleeping at night, anxiety, depression, because it's a happy hormone.
Okay, it's a happy hormone.
It's a happy
have any of
hormone.
that anymore.
So I keep women on it all month. We don't need to cycle through PMS. We don't need to go to a 0 and feel like garbage for a few days. We can just take that plant base and sail through it, and we could take 1, 2, 3, whatever you feel good. You're not going to overdose.
I love
So
that.
that's what that's for. Estrogen. Here's the one that I get on my soapbox about, because there's no safe estrogens in primary care. But you know what estrogen is responsible for in women? Your vagina not closing up shop.
Yeah.
Yes. The tissue's thin, they tear, intercourse becomes very uncomfortable. I had a lady that completely closed off shut.
Really?
Yeah, so you need that.
Yeah.
It controls bladder leakage to a large degree with the sneezing and coughing and peeing yourself.
Yeah.
So if you think about, and your bones from osteoporosis, and it's for heart health. So if you picture us as 65, 7-year-old women with no vaginal health, wetting ourselves in adult diapers, bones decalcifying, sounds like a fun
Hell.
time to me.
Yeah.
Right, and that's
like
where
hell.
they leave. That's where they leave women. Men are never left to suffer like that.
That's true.
They are never left to suffer. You
Yeah.
hear all the time, you have ED, you have low T, hair club for men. I'm not capital. I'm just saying the
Yeah,
world
it is interesting.
really
Yeah,
rallies for
And then
men.
women, we're
Really
being
true,
told,
yeah.
well, you know, you started menopause and you just need to age gracefully.
Yeah.
And like we're
I
just
want my
supposed to
vagina
suffer.
closing off.
Right. And,
Right.
and then if you look at the
You
statistics.
want a swinging door, sister?
I want to be until I'm 68. Right?
Yeah, longer than 60
Yeah, I mean, and like, well, like in my mind as an adult now, I'm like, I'm for sure, like my parents definitely aren't having sex. Like my mom doesn't seem like she could have sex, but I'm like, I want to be having great sex when I'm 68.
You know what? They are.
Okay, that's
they
great.
are because I see your parents.
That's true. She's like,
I
see
hear
your
it
mom.
all.
She's doing great.
Yeah, like they're rocking it. They're the ones on the razors and in the boats. They come back and tell me later what they're doing in public.
I love that.
I'm like, well, I want to see the video.
Yeah.
So I read this book.
that.
I'm not sure if you've read it before. It's called Sex Lies in Menopause. It's by a lady named something Wiley. She's got like a Wiley protocol, some sort of bioidentical. But one of the things that she said in the book is that once women reach menopause, that the chances of breast cancer and cardiovascular disease go up, and that it's correlated with their estrogen going down. Is that
Correct.
Is that
It's true. Estrogen is essential for cardiac health and to reduce inflammation.
So do you promote then with that, I mean, as far as just general health, that women not after menopause, like just let their bodies go, but to actually kind of keep themselves younger and living longer with hormones?
I start treating women at 18 years old across the span of time. So we're together a really long time because we supplement thyroid if we're hypothyroid for life. If we need insulin, we take insulin for life. Why do we see these hormones as optional? Because big pharma has no safe approach because they can't own the plants and take over the country with it.
So they've told us this narrative of, oh, well, you're just done at this point, and then
Right.
you get to die.
I'm telling you, if a man became permanently impotent at a certain age, they wouldn't just let it go. They don't let it go.
That's like
Right?
a mic drop.
Yeah,
Yeah.
that is.
And Medicare covers it. Unfortunately, with this type of medicine, is that insurance doesn't cover it. But it's well worth it. What would you sacrifice or work harder for than to just feel great, right?
Yeah.
I'd cut out anything. I consider plant-based hormone therapy one of my vital signs, to be honest, because if you don't feel good and your intimacy's dead in your marriage and you have no drive for life, there's no quality there.
Yeah.
Yeah.
No,
Well,
it's
then
definitely worth it.
we blame the fog, the brain fog, on mom brain, right?
That's
We just
low
find that we have so many
testosterone.
kids and we're overworked
Yeah.
and underappreciated.
And then
Or
they
we get on
get you-
antidepressants thinking that it's depression, and it's
Yeah.
just it's hormones.
Because they'll give you that, they'll give you other off-label uses of medications which make you fat and slow and stupid.
Yeah.
So I had one doctor tell one of my patients, get a candle and a nightie.
What?
Oh, well, that'll flip the script.
Right. I honestly was shocked. So I already referred last week. I was just taking my testosterone, and I'm not joking. I had 500 comments of people in the Utah Valley who were like, "Wait, you're only 33. You're on hormones?" Like they thought it was the strangest thing.
Yeah.
Like maybe I was ill or like.
Right,
I'm like,
because they
yeah,
think it's
like,
a
that's how you're
destination.
supposed to- Yeah,
I love that
exactly.
you said
Yeah,
that.
and they were just
Yeah.
they were like, "Why are you on that?" Like thinking I had some problem. And I was like, "Oh, fatigue, low sex drive, same thing. Like not sleeping well, mood swings, like working out in the gym and not. I'm still the same, you know."
Right. As women, we're always going through different levels throughout the month, right? So my goal is just to bring balance. So we're not doing so much of this. And so why I like the pellets is they're a steady release. Shots go in for a couple days and come down for a couple days. Some people feel that, some people don't. Shots don't work for
And
me, but I
forget
stay
mine
plant-based.
sometimes.
There you
So
go.
does that mean I'm just really just?
You're just
I'm
kind of,
just tanking.
yeah, you're just tanking.
Phew, okay.
You're just white
And it
knuckling
makes
at that
sense, like
point.
as hormones in our bodies, it's already kind of naturally flowing at all times, I imagine, at some level. So to have like these bursts because you took a pill or you took a shot, that wouldn't mimic, I think, your body's natural way of having it flow through your body.
Yeah, and when you think about what is youth? When are we beautiful? When do we feel
When I
like
was
we were
19,
at our
I was the prettiest.
And your hormones are thriving. So I want to run everyone's levels where you were 20, when you're 60. Be the best version of you. Avanti, what it means is welcome, and it's also a battle cry. And women need to know that they can get some help. So I'm so grateful
I
you've
love
had me on here so we can do a shout out, because how do you reach people if you're not
What
big
they don't know
pharma?
about- yeah.
Right?
And like you said, women, we don't know about, like she's saying, people are reaching out because they don't
I was
know
so
that
shocked
it's
at how many people
it's
thought it
something
was
that
weird.
they can go out and do, because I don't think
Right.
we're educated on it, right?
Right.
No.
Just the basic health and how.
No.
'Cause, like my
Oh.
friend was like, she's like, you have a kid, right? You're like, I have a baby. I don't sleep. Like me, I don't sleep. It's like you see your husband. Like I'm awake at the weirdest time at night. Like, and I'm up for like 2 hours at night.
And then you wake up your host because you're awake.
I
right?
do.
I know you told us that on another episode. So
Like,
we're
I'm just awake, like for no reason. And then I went to my doctor. Like I do not like taking medication. Like even for a headache. Like I grew up in Haiti, and herb is like all life. Like I drink my ginger tea every morning. Like my period is only 1 day in the month.
What?
Like I just don't like taking medication. So when I went to the doctor, I was like, I can't sleep. I know I had a baby, but before baby, like I just never sleep. And it's like, well, you can take. And I'm like, no, thank you, because I just don't want to put things. And I'm like, it's an imbalance in my body. I know that, but I don't want to take medication that you're prescribing me to take for the rest of my life. Like if I have to, sniff some oil, I will do that. Like you know what I mean? Like,
But isn't it sad, just because they don't have safe treatment for us, that they act as though what they're doing is helpful?
Yeah.
It's harmful. If you want to take a woman who has no sex drive, finish castrating her the rest away and throw her on an antidepressant, right? Right? Let's just pour some fire on that. It's terrible. They don't do anything that makes it better, and very few will refer to somebody who does bioidentical hormones. And so everyone's got an opinion,
yes.
but there's a safe way to do hormones.
Yeah.
And you're never too young and you're never too old.
Yeah. Okay, Kelly, I've heard a rumor that there's something called an O shot that helps you with orgasms.
What's an O
What is
shot?
it?
An O shot. We're going to spin down your blood and take the platelet-rich plasma. It looks like liquid gold, so it's the best parts of your blood with all the growth factors. We're going to numb up your G-spot and your clitoris, and we're going to fill it up.
So this is like the O.
Like orgasm shot.
I've never heard of this.
Yeah.
Does it
so
hurt?
no, it's a very comfortable procedure. It takes usually a few weeks to really get to kick in. Some people experience it sooner.
Okay.
It
not gonna walk
varies.
out with an orgasm.
And do you get the shot like once a month, once a year?
Okay. They say once a year, but I think twice a year is a little more fun.
Okay, yeah.
So what is it
back
actually doing?
It's going to plump your G-spot, so it's the target you don't miss.
So when he goes
Like it
in
makes it
there, he
actually bigger?
always
He's always hit, yeah.
So it makes
yeah.
it more. It makes it swollen.
It's going to turn it into a marble.
What?
it's always sensitive.
Yeah, it's going to be sensitive. It's going to pop it.
wow.
So it's
Yeah,
always
so you
gonna-
don't ever miss.
It's like he threw the target, he hit it, and
Yeah,
you bust.
it's a dartboard you don't miss.
Botox party. I'm gonna throw an
O shot party. Whoever's brave enough to get. I want the O shot.
come to my shot party in the bedroom. Oh my gosh, this is perfect. That's your next business plan, Kelly. O shot parties.
Shut parties.
Yeah. How long did it take? Like quick fishing?
Oh, we book out about an hour because it takes about a half an
Numb
hour
it.
to numb and get your blood
Okay.
spun down.
That's when I can be sipping on like a little champagne.
Right.
Okay.
But it's only about 10 minutes to inject those two areas, and your clitoris is more sensitive. You're adding growth factors. It is rejuvenating to those areas.
Do you tell them
Okay.
not to have sex a certain amount of time
Oh, that's a
after?
good question.
We usually have them wait for about 2 or 3 days.
Right.
You know, it
Which
might
you're
be
probably
a little-
okay with, otherwise they wouldn't have gotten the O shot in the
Yeah.
first
Right,
place,
right,
right?
right.
Like, they're like, this
People
is
don't know
normal for
about
me.
this stuff. Like
That's
it's
right.
Right. Do they do this for men too?
They do. It's called the pea shot.
Okay, I had heard of the O shot. I've not heard of the
Yeah,
pea
so
What
the-
does that do
The,
then?
the
What do
pea
you do?
shot's we're gonna spin down the same blood product from men, and I inject it into the shaft of the penis and then into the glands, but they're numb as well. It's a very small little insulin needle.
Okay, are men like lining up? My husband would be like, "Get that needle away!" Like I can't.
Mine
picture
gets
a
in
man.
line for it, so.
Wait, what does it do
But
for
it's
the
not
blood?
even
Numb him up.
Yeah.
I mean,
Does
if it
it
makes
make them last longer or
Yeah.
stay
Yeah, what does it
hard
do?
longer?
So what it's doing is it's increasing sensitivity for them. It's adding new growth factors so they get tissue regeneration. Some believe that they have more growth from it, but it's really more blood flow because you're just rejuvenating the blood pathways and you're prolonging the ejaculation so the orgasm is better.
So you can go in
So
as a
sensitive.
couple.
Anniversary. You get the O.
And
you
then
get
I
get the O,
you get the P.
Yeah. But then you have sex for like 2 seconds and you're both like, oh. That's like
Well,
not
Hey,
the
it's
same.
better than
Hey, we got things to
nothing.
do. We got kids to be back
Didn't you
to.
say that the pea shot helps with like longevity?
Prolonging.
Yeah, that's not a problem.
Oh wow.
Yeah,
Okay,
it's just
so
a better
with the
experience
woman,
for the man.
it makes, like you said, a bump so that it's ready.
Yeah,
You never
yeah.
miss it. With the guy,
Enlarges it.
like, is it
Extra
making? Are they
blood
like?
flow.
Are they like walking around with like? Are they engorged all the time? Like, what's going on?
No. But when that time comes around,
Then it is.
it is.
Got it.
Yeah. It does because you have more blood flow.
This is the Brave Talk Show. These women need to know.
Yeah, so you have more blood flow,
So
you're
they got
bigger.
a little bit more of
So
a
their
growth.
penis is bigger.
More blood flow. I never sell size,
Okay.
but men report size.
Okay. You heard it.
If I could sell size, I'd be a wealthy woman.
Yeah, that's true.
It's not about the size. It's about
But 8 out of
emotion
10
the
men
ocean.
report.
That's true. I love this.
Performance.
Okay.
Yeah, so that's fun.
Do you do
Wonderful.
any other special things for the vagina?
She loves special things right here.
Well, like, okay, so testosterone's going to help with your drive and your libido. We got the O shot for orgasms. What
Right,
else can we
progesterone for
women
your happiness,
be doing?
estrogen
You know, we
for
can
your health.
actually add PRP and plump the lips.
The lip.
No, you.
Oh no, she got her lips cut, so
I
she
got
doesn't want the
labiaplasty.
plump.
Okay.
And I actually have less sensitivity now.
Oh, yeah. So platelet-rich plasma will increase sensitivity. Labioplasty is, I think, one of the top second, I believe, procedures in the state of Utah.
Amazing.
Yeah. I mean, I love how it
Yeah.
looks aesthetically,
Boob
but I
jobs
kind of
and
feel
that.
like.
So they got
It's
no
less.
feelings, but they want it gone.
Well,
That it is?
they
It
hope
looks
that
better.
doesn't happen, and they say like, we hope you don't
Who's
lose
really
sensitivity,
looking down there and be like,
and I think I have.
Yeah, I don't.
But I'm gonna come to you. We're gonna,
Yeah, because we can
know.
put platelet-rich plasma in like the labia majora or even the minora, and you can pop that area. So you look like you got a flat tire.
Oh, okay, that's true.
Have
So
you ever
the-
seen an old lady flat tire?
They look like wizard wings.
Yeah, or
so the plumping
What
of
do you
the
mean a flat
lip
tire?
yeah,
help give it more.
sensitivity.
Instead of like
And
dangling
it's,
raisins,
and
they're
it's
like,
aesthetically
plump?
very youthful.
Can you
if
do
you
that?
already
Can you do that at the
plump?
same time?
Then you don't need me for that. You need me for something else.
I'm just
just wondering.
I'm not surprised, Vanessa.
Yeah, perfect face, perfect everything.
Oh no! I told you I need to go see. I need the pill in my head because I got no feelings here.
No sex drive.
Can you do the O shot and the lip at the same,
Same time, you can. Yeah, and some women have a little bit of the labia minora that's exposed, and sometimes they'll plump that. They call it a wing lift.
I'm perfectly fine with my little.
Get a little tongue out.
That's perfectly fine.
Yeah.
It's kind of cute.
I've never seen another woman, so I don't know if mine looks normal
Look
or
at the
not,
wall of
so-
vaginas. There's a plaster wall of vaginas.
The wall of
What?
vaginas.
Yeah, that's plastered on a wall.
Can you Google
You
this?
just Google it. Yeah, the wall of vaginas.
You can just see what different
Some
vaginas
look like
look like.
stingrays are coming out. Some are closed.
You're
Like
like,
there's
I'm
the
definitely that
variations are.
Really?
Wow.
You can find your
Wow.
personality, like they like which one.
like a
Okay, I have
personality
a question
test.
that I bet our audience is going to wonder. I love to talk about sex, and so when I'm with my friends, we talk about sex, and I've been shocked to know that a lot of my friends, like, don't orgasm very frequently, or have never, or like, what's a healthy amount? Like, what's a healthy amount of? Can you give us a
Orgasming.
reference of like? A healthy woman should be orgasming or can achieve orgasm a certain amount of times.
7 times in one night.
You?
No, that was you.
13.
Man, I would just say if you're in an intimate encounter, you should be able to have an orgasm
Every time.
whether it's once or 3 times.
Okay.
Yeah. But testosterone helps so much. Without testosterone, you just don't have the androgens that you need for the sensitivity generally.
Okay.
Okay, my question here: if someone like myself, I'm 42, I have no idea where my hormones are at. Let's say I am way off from my 20-year-old version of myself. Would you just shoot me up to age 20 hormones right away, or is it like a gradual increase?
So earlier I mentioned that if that's what you want to do, that's what we'll do. And most women are just done. They are ready to get there yesterday. I have maybe 2 out of 100 that say, can we take this really slow? I'm a little scared. And then I say, we can. It's going to cost you more to get there, and you're going to wish you just listened to me anyways. But let's go this road because I want you to feel comfortable, and that's what we do. But most women, by the time they come to me, they're all in.
Yeah.
Okay.
You know, they're ready to go. They're ready to feel good.
I love
Brittany,
that.
do you have some questions?
Yeah, I
would
have
like
some
to hear people
questions.
asking.
how do you lower high estrogen levels? These are questions from our Instagram page that our
So if you're like
followers have submitted.
estrogen heavy,
Yeah,
or
how do
whatever.
you? Is there a way to lower them naturally?
We use
Or not
a
naturally, just-
nutraceutical called DIM to help metabolize and lower estrogen. I don't run into too many really high estrogen-based women unless they're producing cysts, like polycystic ovarian syndrome
okay.
or something like that, where they're just producing extra estrogen. And that goes down when the cyst is gone. Once I get the testosterone up and the progesterone balanced, then suddenly you're not estrogen dominant anymore. So that makes a difference.
So it's interesting how the other ones play a role. And
Yeah,
there's
they
like a
all work
there's a cycle.
synergistically, and
That
that
makes
is a big problem. You'll go to a hormone specialist, and they'll fixate on what they think is going to fix you. And if you're seeing a man, they have no idea what it feels like to be a woman.
Right.
Don't you love when they do the
It's all
pap smear and say, "Well, that
textbooks.
shouldn't hurt"?
You're like, you literally just stuck a pokey Q-tip
Yeah.
up inside of me.
My-
That hurt.
yeah, but that didn't hurt
Yeah.
because they own a wiener.
Exactly. That's true.
They know.
True.
Okay, how often? Another question: how often should you check your levels?
So initially what happens is we get the baseline, we do the treatment, 30 days later we get the follow-up to see where you peaked. And then if you're feeling good, I check them usually every 6 months. If there's any imbalances, we'll check them as much as we need to or as often you'd like.
Okay.
The more I see, the more I know,
Yeah.
I love that.
because a lab really is just a peak hole on that day.
Right.
Yeah.
So I correlate as many of those as I can with how you feel, but I'm ultimately going to treat you regardless of what the lab says. The lab will point me in a direction, but you're the one I'm treating.
Yeah, that
Do you
makes
do,
sense.
is it blood labs or do you do more like saliva?
I do the blood.
Okay.
I think to have somebody spit in a tube for 24 hours, I just think it's better to go straight to the source.
Yeah.
Just get the blood.
Yeah.
So here's another question: what kind of doctors do you talk with about, or what kind of doctors do you talk about hormones with? So maybe not a general practitioner, or like people who don't. If they live in Utah, we're going to tell them to go to you. But if they live outside of Utah,
Who should they search?
Yeah.
Google bioidentical hormone therapy, regenerative medicine, and start reading their reviews.
Okay.
Go to their website, read their testimonials. Because it really, if you're doing a
proof is in
great
the pudding.
job, it really is. Results don't lie when they've got great reviews. And read up on what they do and go in for your consultation. And if it feels like you're going to have a good relationship or could have one, because it really is going to be somewhat of a relationship. It's a journey, and it's for life generally, right?
I mean, yeah, I'm going in there every 6 months, getting your tests and getting new.
Yeah, and I see them most women I see about every 3 months. They like to ride the high wave. And these are women that went from having zero sex, like I call my frozen yogurt women because they'd rather go have frozen yogurt.
that's me right now.
And
Sounds delicious.
they go to where, okay, I bought a vibrator, but my husband has to participate one of the 3 times.
Right. Yeah.
That is hilarious when you get women talking like that and they just spill the
change.
beans. But it doesn't have to be a part-time job like that.
Right.
Right. I mean,
That's just some. Right.
that-
Right.
Yeah, that was an extreme example, but that was somebody who'd been pretty well celibate in a marriage.
Wow.
Yeah.
That's
I
true.
love that.
Well, I think we've answered most of these questions on here just by our conversation. So if we have any more questions come in throughout the day, I'll probably send them over to you guys. And
Where can we find
where
you?
can we find?
Avanti Medical Center. So we're 170 South Interstate Highway in Lehigh. So if you know where the Golden Corral is or Lehigh Roller Mills, there we are. We're in Suite 330. I appreciate you ladies having me on so we can get the word out on the street.
you have
and
an
Are you on
help us
social
minister.
media? Are you on
Yeah.
Yeah, we have an Instagram, we have a Facebook.
We'll put
What
it
are
in our
those?
show
The
notes.
handles.
A Fenty? Is it
AVANTI should pop it up.
Okay. We'll put it
We'll
in
put it
the
on the
show
screen.
I'm in
description
charge of the
box.
parts, not the social media.
Yeah. That's
Yeah, it's definitely. I think it's great. I think you might see me. I'm only. I don't know.
Yay, let's get Vanessa
I
in
thought you were
there.
gonna see me.
Nothing
I
crazy.
was
Yeah, I'm going Wednesday, so I'll keep you guys posted.
Yeah.
Let me know. I goes.
I'll take an episode, go in with our phones and film it. And all 4 of us go in to get tested.
There isn't a woman you can't make feel better. I mean, everybody could use a bump.
I just want my
right?
hormones. I think it's great. Like the hormones. Like why you're not sleeping. Like, I think that's really great to know.
Yeah.
Like why.
You know, and women hate cellulite. Cellulite is largely because we don't have enough testosterone. So the
Really?
longer you on it, the more you expose yourself to the testosterone, your body starts to tighten and tone. I know.
That's good.
We're all so excited.
It's true,
I
ladies.
love this because I think we should never be complacent feeling like crap. And we often are. Like, we're just like, this is just life. This is just how it is. We just accept it, and we shouldn't have to accept feeling like crap.
Well, I think most of us are like, oh, I can relate. I have kids, and all it takes is one person to be like, girlfriend, you can still have kids and have a lot of sex. Go get your hormones checked.
I love it. I'm grateful. Thank you
Yeah,
for
well,
coming.
I'm looking forward to seeing you. I want to see all the brave ladies soon in my office. Thank you so much.
Thanks,
Thanks
Kelly.
for coming.
All right, that's a wrap for this episode of the Brave Talk Show. If you're watching us on YouTube, there are more episodes you will love on that window to the right. We'll see you on the other side. Bye.
Bye.
I have some